We're doing the book here, Prevent and Reverse Hypertension by me, Pete Rogers. We're on, if you're following on the book, we're doing figure 228. This is like part 18, I think, of Prevent and Reverse Hypertension lectures. I basically go through all the images in the book. I don't go through all the text because that would be too boring, and I ad-lib and highlight and stuff, so it's not exactly the same as the book, but it's similar to the book. Okay, MPO is myeloperoxidase. That's the main thing in the neutrophil granules. And when the neutrophils are activated, those are the white blood cells, the guard cells of the body. They release this chemical, myeloperoxidase, and it's very positively charged. Positively charged in medical words means cationic, and it binds to the negatively charged endothelial cell, arterial lining cell, glycocalyx, and then it collapses it down. And when it collapses it down, then the shorter in height adhesion molecules become exposed, and they also cause release of these metal metallic proteinases that cut the core proteins, the syndicans, and those are then shed away, but the adhesive molecules remain in place. So now the white cells and the red cells start binding to them, forming clots. So this is why you don't want to routinely eat high-fat meals. It's bad for your blood flow. Okay, so here's this paper. MPO, myeloperoxidase, reduces endothelial glycocalyx thickness dependent on its cationic charge. So the good number for this is 666. So 600 is the height of the endothelial glycocalyx, 600 nanometers. 60 is the height of the adhesion molecules, and then 6 nanometers is the height of the plasma membrane thickness, the phospholipid bilayer. Okay? So now I'll show you in picture form what that was all about. So this next illustration shows that. So here is a normal endothelial cell, 600 nanometer high glycocalyx. Glyco means sugar, calyx means coating. And it's sort of like treetops sticking up over a hill if you were like flying a helicopter and looking down at it. And these little curvilinear things here, the green things, those are the adhesin molecules, something like VCAM, vascular cell adhesion molecule. So when a neutrophil is activated, which it becomes activated when you eat a high-fat meal, it starts releasing its granules. Neutrophil granules are released into the extracellular space, into the blood. And they're very positively charged. That's cationic. And so they interact with the very negatively charged, the zeta potential. You have a very negative charge on your endothelial glycocalyx because it's made out of repeating disaccharides, a heparan sulfate. The sulfates are all negatively charged. At the end, you have sialic acids. Those are negatively charged. Within it, you also have cholesterol sulfates. And those are negatively charged. So it's very negatively charged. The negative charge is called the zeta potential. All the normal stuff in the blood, the big players, the red blood cells, the white blood cells, the albumin, they've got negative charges, and the endothelial glycocalyx, they all have their own zeta potential, so they don't stick together. That's normal. That's what you want. But when the neutrophil releases these MPOs, they're highly positive charged, very, very cationic, binds to the glycocalyx and collapses it down. And once it's collapsed down, then these adhesion molecules are exposed, and the neutrophils can bind to them. Okay? And that's a bad thing. You don't want that. So routinely eating high-fat meals, it's just bad all around. It also can cause distortion of the endothelial glycocalyx on red blood cells and distort their shape. Okay, we'll see how red blood cells can be distorted into a microcyte, a smaller size, into acanthocytes. Acanthocytes just means spikes in a few locations. Echinocytes means spikes all over the place. And these are going to decrease oxygen delivery to the tissue, so that's bad. Western diets induce blood-brain barrier leakage in rats. Yeah, they make you stupid because they cause leaky gut. Anything that causes leaky gut tends to cause leaky blood-brain barrier. Then you expose, the bacterial endotoxins, LPS from gram-negative bacteria, lipopolysaccharide, LTA, lipoteichoic acid from gram-positive bacteria. They get into the blood through the leaky gut, the increased intestinal permeability, and they travel in the blood to the brain, and they can cause neuroinflammation, activation of the brain guard cells, the microglia, and that can cause inflammation in the brain when the microglia release their chemicals because they think there's a bacterial invasion, so they want to kill the bacteria that are invading the brain. And when they release their toxic chemicals, they'll cause collateral damage on the adjacent neurons. That's how you get neuroinflammation from leaky gut. Here's a picture of abdominal pressure syndrome figured out by Dennis Burkitt way back in the 1960s that a lack of dietary fiber causes straining at the stool from constipation. The back pressure causes diverticulosis, little outpouchings of the sigmoid colon wall. Those can pop, cause inflammation as stool spills onto the mesenteric fat. That's called diverticulitis. The back pressure causes the stomach keep popping up into the chest until part of the stomach, a hiatal hernia, pops into the chest. And then gastroesophageal reflux, GERD, gastroesophageal reflux disease, because the stomach acid goes up in the hiatal hernia. The lower esophageal sphincter between the esophagus and the stomach becomes more patent, less tight, and some acid rinses up in there, causes a Barrett's esophagus. That can lead to esophageal cancer. The dried out stool precipitates on the right side of the colon, can block up the appendix. The mucus glands keep secreting beyond it, and then it can pop, and that's appendicitis. The back pressure into the leg can cause varicose veins. You can also get varicose veins in part because of genetic, in part because of congestive heart failure, venous stasis, fluid overload, prolonged standing. They all contribute to it. But abdominal pressure syndrome is a big contributor. Back pressure into the veins of the scrotum, varicocele, can cause male infertility. Back pressure in the veins of the rectum causes rectal hemorrhoids, can cause bleeding, blood on the toilet paper when you wipe. Increased incidence of inguinal hernias, periumbilical hernias. That's abdominal pressure syndrome as described by Dennis Burkitt. Okay, so fiber is your friend. You know, like the Jeff Nelson proverb, fiber is life, pharma is death. Okay, and here's what happens in the gut to prevent leak gut. The reason I'm showing you all this stuff is all this stuff contributes to hypertension. When the neutrophils, the white blood cells, are inflamed, they create these secondary inflammatory reactions that contribute to hypertension. When you've got leaky gut, you're going to have secondary amyloid clotting that's going to contribute to hypertension. So here's leaky gut. Normal dietary fiber goes and feeds the smiley face bacteria, the good bacteria. They make it into short-chain fatty acids, in particular 4-carbon butyrate. 4-carbon butyrate goes to the enterocytes, the gut's the enteric tract. These are the lining cells. They use that to make tight junctions. And these tight junctions then prevent bad stuff from getting across the gut lining. When you don't eat enough fiber, you eat toxic stuff like oils, alcohol, fluoride, excessive chlorine to sanitize your tap water, the stuff in processed food with the emulsifiers, the carrageenan and the polysorbates, all that stuff, and other chemicals, NSAIDs for example, they will damage the gut lining. So these tight junctions are destroyed. Then bacterial endotoxins like LPS, LTA can get across, get into the blood. The bacteria themselves can get into the blood. Not good. Okay, this was also a little bit about your estrogenic levels go up because the bad bacteria also have more of an enzyme called glucuronidase. So the previously excreted estrogen that's conjugated to glucuronic acid, the glucuronidase enzyme from the bad bacteria cuts it, and then the estrogen's reabsorbed into the body. Higher estrogen levels, which is slightly prothrombotic in and of itself and to a mild degree contributes to amyloid clotting. I haven't really spoken about that much, but there's papers on that by Douglas Kell and Etheresia Pretorius, that in addition to LPS and LTA bacterial endotoxins and free iron, high estrogen levels also contribute to amyloid clotting in the blood, which is very prothrombotic, refractory to lysis, and goes around plugging up arteries. Not good. So the same woman who's at increased risk for fibroids is at increased risk for amyloid clotting. And this just shows the amyloid clotting in more detail. Normal fibrinogen protein in the blood, its secondary protein structure, this is basic biochemistry here, is alpha helix like a cylinder. But then the LPS, LTA, bacterial endotoxins, or the free iron or high estrogen levels cause it to change the beta-pleated sheet, and then they stack up, okay, like a deck of cards, and they precipitate. The higher the molecular weight in aqueous solution, the more likely to precipitate. To precipitate is to clot. And then these clots are 2 to 200 microns. They travel around the body, plugging things up. They're relatively refractory to lysis, so they can contribute to dementia, plugging up capillaries in your brain. They can contribute to angina, atrial fibrillation, coronary syndrome X, microvascular angina by plugging up small arterioles and capillaries. Not good, so that's why you want to eat your fiber and avoid all this bad stuff so you don't get leaky gut. Okay, I think we'll leave it at that for today's session of Prevent and Reverse Hypertension. I hope you found that helpful.